Hi guys, Patrick Hanley from APC Physio. Just want to talk to you today about neck pain. The most important thing that we see with our neck pain patients is that we need to get to the real root cause, okay? And a lot of people who attend us for physio over the years, they feel that the number one thing that they haven't got from their treatments is the person hasn't listened to their story properly. So we need to listen to your story to get a proper handle on what the problem is, where it's come from, what it's affecting you doing and stuff like that. And all of this background history is really, really important. So we spend a lot of time on that at the start to make sure that we tick all the boxes and we don't miss anything. Then we do a movement assessment to identify the root cause and to see what muscles or joints or whatever is causing it. So if we just use this model here, excuse my artwork now, but here's the head, the side of the neck, and into the arm. So if a part of this system is not working properly, so the lower arm, the upper arm, the shoulder, and the neck, they should all be working at 25% so that all the systems are working equally. But if one part of the system isn't working properly, so we'll just say the shoulder muscle is only working at 10%, therefore, and then the neck may have to make up that difference to end up doing 40% of the work if you're lifting and pulling and twisting with your arm during your daily activities. So in fact, in that case, the neck is doing a very, very good job, but the muscles around the neck are getting overloaded, and that's what could cause a pain. Now that's a simplified version, but it can be very much an integral part of the explanation. So the whole idea of what we want to do is we want to make sure that all of those parts are doing their equal portion of the work. And then sometimes you might look at it from the neck here down into the mid-back as well, and down into the hip, in fact, to make sure that each one of these parts, that the hip is doing 25, the back, the lower back, mid-back, and neck, they're all doing 25. But if one part of that is not doing its fair share of the work, another part has to compensate. So this movement assessment identifies those compensations, and we correct them with hands-on treatment and tailored advice afterwards. So that is really, really important, because the rehab exercise that we give, they're not generic, they're very, very specific to you, okay? And they will help you then to achieve step 4 in our process, which is restore movement and get you back to the things you enjoy doing in your daily life, be they working, physical activity, sport, or whatever. And then step 5 in that process is that we continue to support you and empower you to achieve your long-term well-being. So be that doing gym-based classes, home exercise routine, or whatever other exercise to maintain you and keep you where you've been, your new level of performance and function, that you do not go back to where the pain was. So we need to make sure that you stay there and even improve a little bit better over the course of the coming months. Okay, so that's how we treat neck pain using our 5-step process.